Thank you very much, Marion. I'll just share my screen now. And good to be speaking to everyone today. Just going to share that here. So as Marion's already said, I'm presenting on the Jamaican 60th celebratory event that we had around arts and health. It's one of the arts and health projects that we delivered this year within public health. So just to give some background information on the project, every year on the 6th of August, Jamaicans celebrate Jamaican Independence Day, with this year being the 60th year of independence. So the celebration was tied in with arts and health, raising awareness in 5 topic areas. Those areas were pregnancy, mental health, diabetes, cardiovascular disease, and musculoskeletal disease. In terms of pregnancy, we looked at participatory workshops with podcast style recordings, and that was delivered with a Jamaican woman who was able to talk about culture and ensuring that the Jamaicans can keep their culture during pregnancy. Mental health looked at food and mood sessions. They also did a physical activity trail and went to a botanical garden. Diabetes and cardiovascular disease were centered around cooking workshops, focusing on managing sugar intake for diabetes and heart health for cardiovascular disease. And musculoskeletal disease was a drama and storytelling performance to talk about how to improve access to healthcare services. You can see on the right-hand side there, that was one of the leaflets that was given out to attendees. So to talk about some key achievements from the project, pregnancy educational workshops, which were culturally appropriate and focused upon key health inequalities that Black, Caribbean and Jamaican females face during pregnancy. In terms of mental health, helped to support participants to give an opportunity to share experiences and stories about Jamaican culture, helping to improve self-esteem and confidence. And in terms of musculoskeletal disease, it helped to facilitate an improved health outcomes for older Jamaican people by bolstering their confidence and readiness to engage with contemporary healthcare services. And that is including digital healthcare, whilst also recognizing the difficulties that they may have encountered. You can see on the right-hand side of the page, Anansi is an old Jamaican folklore tale. And Anansi is a very clever character, but one character that has their head one step of the game. So that's the idea of musculoskeletal disease, being one step ahead of the game with arthritis and knowing how to manage your condition beforehand. Cardiovascular disease, the key achievement from it was an impact on behavior change through a practical cooking session with participants who are Jamaican or of Jamaican heritage. In terms of the diabetes session, the project was hosted and managed by Black female health professionals who are also registered nutritionists and registered associate nutritionists. And this is a key area to consider when engaging with these communities, that they're having role models to learn from in terms of those skills building, the confidence, and to make sure that Black females are given that opportunity to deliver in a professional capacity in that way. So a real good success to have that within this project. In terms of impacts on social change, we really felt that we engaged with a high percentage of Jamaicans or people with Jamaican heritage. And this is typically a community that at the council, definitely, but in public health as well, we don't always tend to engage with. You can see a quote there that came directly from a participant as well. The ladies really enjoyed doing something different. They got to feel some real talent amongst them and got to showcase their talent as well. They said that one of the ladies shared a beautiful poem that she wrote about Jamaica, and that she said at the end, "Have a blessed evening." So it was really good to celebrate that culture and give people that opportunity to feel like that their voice is heard and to feel like that they are engaged with. We also felt like that we investigated the cultural traditions and talked about how we can change some of those cultural traditions to improve health, but also while keeping the culture. So still keeping some of those recipes that people of Jamaican heritage might eat, but reducing sugar intake and reducing fat intake as well to help manage heart health or to help to reduce the risk of diabetes and help with managing the condition as well. In terms of relevance in 2023, I don't know if anyone's come across the Blachier report. So the Blachier report is a combined Birmingham and Lewisham health inequalities review that seeks to address some of the health inequalities that are experienced from our Black African and Black Caribbean individuals. The full report is on our council website, and I can pop some links in the chat afterwards to talk about where you can access the report, and also how to be involved in terms of addressing some of the opportunities for action and recommendations from the review. The other one as well is our list of community health profiles. So we've got a community health profile on the Caribbean community, that looks at some of the health inequalities that are experienced from people with Caribbean heritage. And again, we'll have an engagement partner with that, so people can get more heavily involved in the work in that, looking to address some of the health inequalities within that Caribbean community. That's it, just over 5 minutes, I think. But yeah, if anyone's got any questions, then let me know. I'm going to pop some links in the chat now if anyone wants to find out any more information offline as well.